New York, and on the new Hot 97 app. Ebro in the morning on Hot 97.
You know, we talked on Friday. We said this weekend was going to be tough. It was. The numbers that we're seeing are just, the death toll, because that's the number I look at now. The cases, that number is just skyrocketing. But as we know, 80% of those people will get to the other side. And that's been a consistent truth. But as you get more cases, also the incident rate of death goes up too. See what I'm saying? That's not going to stay flat. That number's going to keep going up as you get more cases.
Right.
And so I've been looking closely at that number, and when on Saturday and Sunday I woke up and it was over 230 or 260 deaths in a 24-hour period. They haven't reported, at least I haven't found a report for Sunday into today. And I'm hoping that number isn't higher, but it could be. And then you have exponential, like an explosion of cases, because now they're testing in New Orleans, Detroit, and these other places now. And so that's going to become a big story. But the coronavirus, COVID-19, is our new reality for the next little while. And there's no way around it. There's no way around the reality that you must stay home. You must keep your kids away from other kids, because kids can be a carrier. And we're lucky that I haven't heard of any cases where kids have been positive in an ICU and on a respirator, that this isn't adversely affecting kids. But I have heard of 10-year-olds and 11-year-olds, right, Laura? You know a couple of younger kids that the whole family has it, right?
Yep.
But they're doing fine.
Thank God the kids bounced back quick. So that was a blessing.
Way
faster than the adults.
That does seem to be true. Not that you can't be a carrier, but that for the most part, kids have been safe. Like I said a few weeks ago, I know it's dark to think about, but we are so lucky that's the case. So lucky.
What? Super. Dino is a nurse on the front lines out here in New York City. Before we get to flashing lights with Laura Stiles, Dino, what's the one thing you want the people that can hear your voice to know that maybe the media or we're not understanding about what's happening in these hospitals?
Morning, guys. It's scary out here, man. Like, people come through with these symptoms, and I think what people aren't understanding is, like, you could drop off your aunt or your grandma or call the ambulance to pick them up, and that's the last time you ever see them. Like, it's that serious. Like, you drop them off in the ED, we pick them up, they test positive, you don't see them again. When they die, if they don't recover, that is, you don't see them again. Like, they get intubated, they go into an ICU, and that's it. You can't visit, you can't call, you can't see them, and if they die, you can't come get the body, So it's scary out here. Wow. I want the people to know that, nurses and healthcare workers, we need your support, your encouragement. Like, write us a letter, let us know it's, you're thinking about us too, because it's not easy working out here.
Dino, we love you for your work, man. Salute to all the medical
Thank
workers and everybody on the front lines.
Thank you, guys.
Thank you, Dino.
I can't imagine how scary it is. I saw a video, Ebro, yesterday on 60 Minutes. They were showing one of the best facilities in the country. I forget exactly where it was. It's where they brought a lot of the people who were on that ship that was docked in Japan.
Yeah.
So that's California then.
And they do like a great job. And anyways, they showed video that they bring people in on these gurneys, and the gurneys are like these complete bubbles.
Yep.
And then the people caring for them are wearing basically complete hazmat suits.
Mm-hmm.
Yeah.
It looks so scary to see, like to see your loved one getting taken away in like a bubble gurney, taken by these people in hazmat suits. I mean, just on a basic level, that's terrifying.
That's crazy.
The isolation that Dino just spoke about, with regard to people getting sick, when I read the articles about what's going on in Italy, where you have maybe 8,000 people have died now in Italy. You had people, because they were on quarantine and at home, who were dying alone in their apartments.
Yeah.
Like, family can't come see you. You can't leave your apartment.
Because it's that contagious.
And so you're suffering alone in your apartment. We're not hearing those reports here in New York City yet, but I'm sure at some point we have to prepare our minds and our emotions for that reality.
Sorry, Shawnee, I was just going to say that we have this thing of like, it's older people, so in some way that makes it okay. I have a good friend who's around our age. Life has been great, normal, really has a nice life. All of a sudden, the other day, his father died completely alone. He never saw his dad again. His mom didn't see his dad again. And so, like, we can all try to make ourselves feel a little better that it's not young people. And, yes, that's very positive. But if it's your father or mother who dies alone.
Still affecting you.
Come on, man.
The person that I know right now who's in ICU, he's 35. 35 years old.
Yeah, he's still in there now?
36.
Yes. He's in a medically induced coma, guys.
Jesus.
Somebody's 36 that's in right now, too.
Yes.
And also, don't forget, this affected more than people with just COVID. Like, even up until this weekend, women that were having babies were not allowed to have anybody in the delivery.
Oh, my
That's
God.
right.
Yes.
Yeah, that too.
By themselves. I think the governor just passed ordinance over the weekend that they're allowed to have one person in there with them.
Right.
But imagine that. Like, you're having a baby and you're not allowed to have not one person in there with you.
Terrifying.
So it's going to it's affecting more people than just people that have the infection.
This nurse wants to remain anonymous. Good morning. How are you?
Good morning. I am just here. I'm just calling to let you guys know that when it comes to the protective gear that we need to work with our patients, we don't have enough of that. There are times when we are wearing one gown all day. We are wearing one mask all day, sometimes 2-3 times a week. This coronavirus is actually wiping us out. We have not had codes like we've had in that facility for years. Patients are dying every minute. It does not matter the age. It does not matter the race. It does not matter what your religion is. They are dying. Okay.
What borough are you in? What borough are you in?
I am in Brooklyn, and we need protective gear for ourselves. We need PPE. We need it.
And so when you see the mayor speaking or you see the governor speaking about getting you guys support, it can't come fast enough right now. You guys are already behind.
It cannot. They're way behind. I know that they're trying, but they need to try harder. This is something that we should have known of a long time ago. It shouldn't have gotten this bad if we had only had the knowledge that this is something that's here in the United States. It should not be. Myself and my co-workers work tirelessly. We're in front. My co-workers are getting sick. We are getting sick. We can infect our family by being quarantined in our homes. And as you said, people are dying alone, and it shouldn't be.
Yeah, no, it's everybody is struggling right now. We appreciate you this morning. We appreciate all the medical workers and everyone on the front lines.
Thank you.
And, the reality is we were not prepared, and we are not even at the apex of this situation yet. So,
no, we are not.
How long are the shifts that you're working, and how often are they?
12 hours, 3 days a week. But there are times when you have to go in and help because there are not enough staff because people are afraid. And the thing that I'm looking at is that we're willing because we know people need us, and we know that we are here to make a difference in other people's lives, and we're trying to make everyone get well and go home. But it's impossible. It's impossible when you do not have the tools that you need to work with. It's impossible when you are seeing what you're seeing. And it's something that I feel something needs to be done. It needs to be done fast. People need to listen, stay in your homes. Let me tell you something. All the material things you have will not help you to stay alive. Hug your families. Let them know what they mean to you. Let them know that they are loved, because that's the most important thing you can do at this time. This is not something you can see. I don't feel they really understand what is really going on. I don't feel they really understand how they can stop this virus. But if we can just listen and try to do what we're asked, it can be a little different. It may ease up some of the deaths. It may ease up some of the people that are out there infected. It is killing young kids in different countries also. It is not, as the young lady said a little while ago, someone she knows is 35 years old is an induced coma. It does not. It does not have age to it.
COVID is not discriminating. This scenario is something that the whole world is going through simultaneously.
Yes. And, you know, I commend you guys for doing what you're doing. Thank you for taking my call. And I just want to say to all healthcare worker out there, God bless you. You are loved and you're appreciated, because I'm on the front. And I know it's not easy. If you have love for life and love for people, you cannot sit by and look at this and just take it easy. Like one day at a time, you're thinking about what is going to happen tomorrow and the day after. It's a difficult situation. And my people in the United States, throughout the world, please love each other. Please, and please listen and try to be safe. It's important to be safe. Thank you, guys. You have a blessed day.
You have a blessed day, too. Thank you for your energy. Thank you for your time, and thank you for your hard work.
Thank you.